Hello, everyone. This is Dr. Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome to Plastic Surgery TNA. As you can see, I'm a little differently dressed than I usually am. It is the Thanksgiving holiday weekend. I still wanted to present to you a podcast episode. It's a little different format. For all of you who have watched me and followed me, I really thank you. For those of you who are new, welcome. Please like and share these videos. What I have for you today is a interview I did probably several months ago with a wonderful, wonderful lady that I met through LinkedIn named Stacey Creagan. She's a healthcare recruiter, and she just wanted to kind of pick my brain about being a physician and being kind of plugged into life. And so we did a really nice interview. I enjoyed it, and I want to present that interview to you. I hope you enjoy it and get some little bit of pearls out of it about some insight to me. So enjoy. Try to have balance. It begins and ends with you. Take time out to not lean all into your operation or your business 24/7. Take time to spend with loved ones on their special occasions. It's okay. You can pull away from the spreadsheet or the phone call, or they don't need to have the meeting tomorrow, and spend some time with your loved ones. So that's the first thing, because you don't get that time back.
Welcome to the Healthy Careers Podcast, where we help healthcare providers succeed on purpose. We take a conversational approach in learning from others who have been there and done that. Join us as we share expert insights from real people who are just like you, because we believe that success isn't just a destination, it's an intentional journey, and you don't have to do it alone.
Good afternoon, everybody, and welcome back to the Healthy Careers Podcast. I'm your host, Stacey Creagan, and today I have a really special guest with me. He's a really amazing guy. His name's Earl Stephenson. He is a board-certified plastic surgeon, and he has his own practice located in Dunwoody, Georgia, called ESJ Aesthetics. So we're going to talk to him today a little bit about his career and how he got to where he is. He's had a crazy wild ride. So thank you so much for being with us today.
Hey, Stacey, thank you so much for having me. I'm really honored to be a guest today. Looking forward to this.
Yeah, we're so excited to have you. So let's kick it off. Just tell us a little bit about who you are and what you do.
Sure, absolutely. So as you mentioned before, I'm Earl Stephenson. I'm a board certified plastic surgeon here in Atlanta. I've been in Atlanta for about 20 years. Grew up in Virginia, on the coast of Virginia. My father was in the Navy. My mother was a teacher, no one in healthcare. And I decided I wanted to be a dentist. And so that's how I started my career. And lo and behold, I'm sure we'll get into it, many, many, many years later, I'm a plastic surgeon here in Atlanta, focusing on aesthetic surgery.
That's awesome. So what made you go from being a dentist to now you're a plastic surgeon? Like, tell us a little bit about the transitions that you made and kind of how you got to this point, because that's pretty big transition from being a dentist to being a plastic surgeon.
It's a big jump. It wasn't something in the forefront of my mind at all. Just like most teenagers, when I was 18, 17, trying to figure out what I was going to do, I remember a Sentinel event. I was sitting in the kitchen. I was talking to my mom, and she, kind of threw it out there. Well, what do you think you want to do when you grow up? And I said, I think I want to be a commercial artist, because I like to draw. I draw with graphite pencils and things like that. And she shook her head, and she's like, no, you don't want to do that.
Absolutely
You're
not.
absolutely not, because you'll never get up from this table. So I said, okay, all right, so let me rethink that. And so in the midst of that, I was a baseball player growing up, and I had an unfortunate incident of getting hit in the mouth with a aluminum baseball bat. And I spent a
Ouch.
lot of time, a lot of time in the dentist chair in Virginia Beach, Virginia. And I just took it all in as I was kind of getting treatment, like, hey, this guy's pretty cool. He's got a cool office. He seems happy. His wife seems happy. He's got, at the time I was a young guy. He's got pretty ladies there. He seems like
in my face.
Yeah, he's fixing my face, so it's all good. So I said, maybe this is something that I can do. So lo and behold, I set out to be a dentist and set forth to the University of Oklahoma in Norman, Oklahoma.
That's awesome. So tell us a little bit more about, because I know you transitioned from dentistry and then you made a couple transitions in there between where you started as a dentist and then now a plastic surgeon. So how did you determine that you were going to make those transitions, and kind of what steps did you take to make that possible?
Yeah, sure. So I plugging along in dental school, just wanted to be an orthodontist. And I got to that third year of dental school and I couldn't bend a wire flat. And so my teacher was like, nah, this is not going to work
You're
out for you.
out. See you later.
You're out. You're out. So, I always kept the motto in professional school and any type of education I had to try to do the best I can, try to end up at the highest position in the class so I have options. So, and lo and behold, I ended up with, graduating in the top 10% of my class. At that time, I also had a rotation with the oral surgeons and at my dental school. So I ended up applying for oral surgery residency and getting in that residency. And that's a 4-year residency. And we spent a lot of time in the hospital. We worked with ENTs and orthopedic surgeons and plastic surgeons. So I got a real good breadth of that type of medical environment. And so I was plugging along. I thought that was going to be fine. So I graduated oral surgery. I ended up in basically Alpharetta, Georgia, long story short. And what I did in Alpharetta, Georgia was noble and I enjoyed it, but it was really taking out wisdom teeth. It was nothing to do with the hospital. And I thought there was a little bit of a disconnect and I became disenchanted. And so, in the midst of that, my third or fourth year at my practice, really mature practice now, I decided to go up to New York and take a microsurgery course because I figured if I can do plastic surgery, it's artsy. I'm an artist. I can work outside of the head and neck, anywhere on the body. If I can sew a blood vessel that's a millimeter, then I probably can be okay. So I, I went and did that, and I was able to successfully do that. So that kind of set me on the pathway to get to, a plan to kind of matriculate from my private practice of oral surgery into back into residency, believe it or not, in plastic surgery.
That's awesome. So, when did you, because now you have your own practice.
Yes.
So, tell us a little bit when you first started in plastic surgery, what did that look like in terms of the practice that you worked with?
Sure.
And then, how did you decide that you were going to make this transition to go into what you're doing now? Because I know that's a really big step for sure.
It is. So, of course, coming out of training, you've got a lot of medical debt. You don't really have your feet underneath you. You've got all the training, but you're really not applied that, in the real world. So, I wanted to really have a kind of a safe environment, for lack of a better term, someone who's been in the industry, who knows kind of what to do. So, I associated with a gentleman down in downtown who, was reasonable. So, I was his associate for about a year. And I felt that, what I wanted to do in that year to two, I wanted to one, get myself reestablished financially, so stable, and I wanted to get my boards. So if I got those things and I can reevaluate, am I happy in the practice? Is the practice going to allow me to grow and and mature? Am I going to get a good stake in the equity of the practice? And do I see this practice growing, and allow me to kind of, again, practice my craft, but allow me to make a good enough living to enjoy the fruits of my labor.
Right.
Unfortunately, it did not.
Well,
Unfortunately.
and medical school debt and all of that, it's like insane how
Yes.
much
Yes.
money
I was a little bit
that
fortunate in
is.
that regard. I went back to medical school in Virginia, which I was a native of Virginia, and I never changed my residency. And so I ended up having in-state residency. So that was
In-state
great. But
tuition. There you
yes,
go.
absolutely. Absolutely.
Smart
So that
man.
worked out. That worked out.
Awesome. So when you made that transition to doing what you're doing now in your own practice, ESJ Aesthetics, kind of how did you like brainstorm that? Like, how did you decide that this was the move you were going to make? And how did you go about making it happen from, in your brain to reality?
Yeah. So when I was with that gentleman that I mentioned before, it just wasn't a lot of transparency. I really didn't know where the practice started, what were the skeletons, and how that would really affect me. And I never could get those answers. And so I'm a guy who likes to know, have transparency. I think that's reasonable. And I figure that I could, the only way I'm really going to get transparency really is to start myself because then I know it from the beginning and the end. I felt confident that I could do that. And so, really, at the depths of the recession in 2007, I started a practice. I was associated with a hospital that was rural that happened to be looking for a plastic surgeon. And so, they gave me kind of a physician's compensation. I wasn't an employee, but they would kind of set up a stipend for me to draw upon to set up a practice. And I would just be available for that hospital to take care of their plastic surgery needs. And so I did that and then repaid that stipend by just paying the taxes on that. Then also I needed to stay around in the area for 3 years. So that really jump started my practice. And so I was able to get that, utilize those resources. It didn't really come out of my pocket. I didn't have to get a loan.
That's
I was
awesome.
able to, yeah. So that was great. That was just fortune. That was just good fortune. There was not really any
That's
planning. I
that's
happened to,
super helpful and luck of the draw.
absolutely. I would say to that luck of the draw, you just continue to build relationships. I just happened to call one of my medical school friends who actually had the same deal as an OBGYN. And I called her on something unrelated and she just told me about it. And so I had a conversation. So one pearl is always stay connected with the people that you build relationships with.
That's so awesome. Yeah, I think a lot of times people just rush through things. You and I kind of talked about this when we met in person, but people really rush things and it's really about the relationship. You never know who you're going to meet or how you might be able to help them or how they might be able to help you. And you guys have just like this great mutually beneficial relationship. So that's amazing. And I think that is a true pearl. Like if you can keep solid, transparent, open communication with people and just continue to foster relationships, even if it is just reaching out to somebody every once in a while and saying, hey, like, how are you? What are you doing now? That kind of thing, it really goes such a long way because then if you have to reach out to them again in the future, they're not going to be like, who are you? I haven't talked to you in like 15
Exactly.
years.
I haven't
Like,
talked to
why
you
are
in
you
a
calling
while.
me?
Yeah, exactly. What do you want? That type of
What
thing.
do you
So,
need from me?
yes,
So
exactly.
that's so
Exactly.
true. But anyways, yeah,
Thank you.
continue on what you were
Yeah,
saying
yeah.
from there.
So
Yeah.
anyway, I was able to do that. And so that satisfied that major criteria that we talked about. I wanted transparency. The only way I was going to really get that is to start my own practice. So I started in Snellville, Georgia, for those of you who know where that is. That's east of Atlanta.
Good old Snellville.
And good old Snellville, where everybody's somebody. So we so I started out there and I was there for about 10 years and I grew up a really great practice there. Had a lot of patients and really built up a good reputation in the community. And it was really, really a fun time, but there's some trying times being an entrepreneur. But overall, when you look at it, it was great. And so my name started getting around the community, of course, with the lay public, but also with my peers. And so a couple of my peers approached me and said, hey, let's try to work smarter, not harder. And let's really combine, economies of scale. So long story short, about 10 years into my practice, a group of guys, plastic surgeons, said, let's get together. Let's do a merger acquisition. And you come over to our place. We have a larger facility. We have an operating room. Bring your patient base and your experience, and let's make this thing go. And so that's what I did in probably 2018. And so I stayed with them for 5 years, and it just was rocky. And the next pearl, I would say, everybody is like dating. Everybody puts on their best face.
You get the
Well,
beautiful person for
you're
the
the
first
beautiful
few
person.
dates.
You just gotta wait, hold, and then the crazy will come out. So the
Like, this
longer
is
you,
why people date for 5 years. You know what
that's
I
right,
mean?
right.
Like, we're just
So
waiting to see the ugly down the line.
absolutely. So I would say this. We talked about rushing, and in that time, I think I might have rushed it a little bit because the opportunity was so great. I wanted to do exactly what they wanted to do, but I knew it would be a longer runway. And I was so excited that I would have a shorter runway that I probably didn't do all the vetting that I actually needed and should have done. So again, patience is a virtue. So anyway, I did that for 5 years and it just didn't work out because our business principles weren't congruent. And so an unfortunate incident. I lost my mother in 2022
I'm
after,
sorry.
COVID. It was my father. I lost my father in 19. It was COVID. And then I lost my eyesight for a time in 20.
You
I had
did?
I had a retinal detachment spontaneously.
Oh my gosh. In
And
both
so
eyes?
one eye, the left eye.
One eye?
And
Okay.
so that was a huge thing because now we had COVID, which dampened my revenue. I was
Right.
battling a little bit with my partners about principles. I lost my father like a year or so before. And then we got back to 21. I got my eyesight back enough. And I was able to kind of build revenue and kind of get back on track. And then again, the partners and I just didn't see eye to eye. And then in 22, I lost my mother. So with
I'm
all
so
those
sorry.
things, it was just too much. So the next pearl is, I had to say, time out. I got to step back. I need to step back from practice. I could afford to do that, not forever, but I could afford to do that to really evaluate where I am, who I am, and what I wanted to do. And so that's what I did for the better half of 22 and some of 23. And then after a while, patients start asking where I was. They would call my cell
Come
phone and say,
back.
"Hey, what are you doing?" I say, "I'm laying on the
Come
couch
back.
trying to figure, I've been
I'm trying
having
to
an
figure my life out.
yes, I'm having an existential crisis on the couch."
I'm
And
eating my bonbons and watching my trash TV and crying in my
absolutely.
pillow.
Absolutely. Absolutely. And that's okay. You can do that. And
Yeah.
so after I did that and kind of got myself a little bit upright and kind of tested the waters, patients calling and asking where I was, and they wanted to do more things with me. I kind of peered into the VA space a little bit because it was a safe space, great benefits. I can go back to Oklahoma, which wasn't my choice, but I was familiar with that and working that VA. But I decided, with being here in Atlanta, having a 20-year basically history in Atlanta, it would be kind of silly for me to kind of uproot everybody and move to Oklahoma City. So hence, I started ESJ Aesthetics here in Dunwoody, and we just kind of pushing forward, ever since that time. It's been about a year now we've been in business.
That's awesome.
Hey, just a quick reminder that I do own a recruitment firm. This podcast is completely separate to it and a way that I can network with you. But if you are somebody that is needing to hire and or find a job, I would love to be somebody that you reach out to. We do have lots of resources as well as market insight to help you to make sure that you're positioning yourself perfectly, either as a candidate or as an employer. You can visit our site or connect with me here at www.advancedscopetalent.com. Let's get back to the podcast.
And you do a lot of really cool things to
Okay. Thanks.
promote your practice. I think it's awesome. I mean, you do your podcast, you do things like this with other people on their podcasts. You just have a lot of really great things that you do, social engagement, LinkedIn, all those things. So tell us a little bit about how you've utilized technology to help you as you've started ESJ and are trying to grow it.
Great. Perfect. Yeah. So the lay of the land has really changed from my first solo practice to now. It's completely different. And I was a little bit, I didn't really see that. I thought I could easily make that transition, but I figured there were a couple things that I didn't really do well in my first practice. I really needed more organization. I needed more systems, and I needed more brand awareness. And so to answer the brand awareness part, I said, look, you have to get out in front of people. At the time in my initial practice, you kind of go and shake hands and kiss babies, and you still do some of that. But now, looking forward, people are all on social media. So I said, let's put our brand and kind of have a shotgun approach initially. Let's kind of put them all platforms, see what platforms are the most responsive, get the most engagement, narrow that down. So we did that. That was the first thing. So we really get a lot of engagement on LinkedIn, a lot of engagement on TikTok, believe it or not. And that was surprising to me, and YouTube. And so with those platforms, I said, I need to stop doing static posts because they're not really doing anything for me. I like to talk. I like to get in front of the camera. And so I said, let's do video. I think video's powerful. It can at least drive people on YouTube, and we can maybe even segment the videos and put them on our other platforms. So with that being said, we just use that strategy moving forward to put them on the platforms that we mentioned. And so that's really been a really great move for my practice and really getting a lot of brand recognition.
Yeah, that's actually how I found you. If you
Okay.
remember.
Yeah, I do. I
Was
remember.
because I saw one of your videos on LinkedIn and I was like, wait, this is cool because you're giving kind of like short tutorials on like how you do things. And it's pretty neat, especially for somebody who's in healthcare, even if you're not a surgeon or you're not in plastic surgery. It's really cool to like hear what you're talking about and have an understanding of how different aspects of your job and the surgeries that you do and the things that you do work.
Yeah,
So
thanks.
that's really neat. That's actually how I found you. So that's funny
Yeah, I
that you say
remember
that
that.
because
Yeah.
it's reaching, and I don't even think we weren't connected in any way prior. I don't even
No,
think
not at
we had
all.
mutual connections.
I remember
So
you reached out to me a couple times, and I apologize. I just got
no,
buried in the
it's okay.
weeds, and we
You
finally
got back to
connected.
me pretty quick. You got back to me.
Okay.
I maybe reached out to you like twice, and then you got back to me pretty quick. So trust me, that's a lot better. That's a
Okay,
lot
okay,
better
good.
than
I'm
some.
glad I know. I don't really know the lay of the land. I felt kind of embarrassed. I was like, yeah, Stacy's been reaching out to me, reaching out to me. I just need to at
No,
least let her know, hey, okay, yes, I'd be happy to meet with you for a period of time. Because again, like we said, building relationships, you just don't know who you know, and anybody I can meet and have a conversation with, it's probably going to be beneficial at some point, even just from a non-professional standpoint. You can just be friends. You just kind of get to know cool people.
it's really neat. Yeah, it's great. And, it's fun too because healthcare is so interconnected. I mean, all the conferences and the things that people do and the places people go, they tend to hang out at the same places and do the same things. So, whenever you're well connected in healthcare, you go somewhere and you're talking to other people in healthcare and you are saying, oh, like, I know this person. And they're like, oh, I know him too. And then it just turns into this whole conversation. So that's really cool. It's a cool way to break the ice. And that's one of my pearls is if you're looking to grow a business in any way or just looking to learn more about healthcare or whatever it might be, like be well connected within the community, reach out to people on LinkedIn, say, hey, like I'm not trying to sell you anything. I'm not trying
Right.
to do this or do that.
Exactly.
I'm genuinely
Exactly.
just interested in what you're doing. And I would love a few minutes to talk with you. And I think it really goes a long way because then you meet people like yourself who have been a dentist to an oral surgeon to a plastic surgeon. And it's like, well, that's crazy. Like you would never think that someone would make those transitions from one place to the other. It's like two opposite ends of the spectrum. So that's really cool.
Right. Yeah, yeah, I agree. Just reach out to people, like you say, if you kind of disarm them, because I think a lot of physicians, at least, think people are trying to sell them something. And so when you try to disarm and say, hey, no, you're just interesting. I just want to meet you. I think it really kind of breaks that barrier and then you really get to know that person. So, and I agree. It's 6 degrees of separation in healthcare. It's a really small community. If you just start to make those connections, you'll realize that you're not that far removed from knowing someone else. So I think it's a really good pearl to have.
Awesome. And then, as far as your practice goes in itself, the scope of what you do, tell us a little bit about maybe some of the things that you do or some of your favorite things that you do that you
Sure,
would like
sure.
people to know about.
Absolutely. So currently, like I said, I've been in practice for about 20 years. I started out with a really broad scope of practice. I used to do hand surgery and burns and breast reconstruction. I did that for many years. So now we really crafted that down to aesthetic surgery. And I really do facelifts. I do a lot of eyelid surgery. And that's one of my favorite surgeries. It's an elegant surgery and it's a very powerful surgery. I do a chin surgery, not so much chin implants, and I will do those. I use my oral surgery training, which I thought would be helpful with plastics. That's why I went to plastics as opposed to ortho or ENT or something. I do a chin surgery where I actually use your own chin. I just kind of use the bone and I kind of move that forward, backwards, or whatever it needs to be done to enhance your profile. So we do that. I do obviously breast surgeries, augmentation, lift, reduction. And then I do tummy tuck with lipo, which is again one of my favorite procedures. It's a dramatic change, and a lot of clients just feel empowered after that.
Yeah.
And do a little fat grafting, not craziness. I do a little fat grafting to the hips to help the shape, a little fat grafting to the backside to help the shape, but not anything crazy or buffoonish. So that's kind of what I do, and that's where we are now. And of course, we do some non-invasive or minimally invasive things like Botox, fillers, and chemical peels.
That's awesome. I think plastics is so cool because you do see so much gratification. Like people who post their before and after pictures, I'm like
Yes.
fascinated. I'm like, whoa, like that is not the same person. So it's really, really cool. And I'm sure that's like very helpful for you when you have those types of moments with people when they're just like, I can't believe that I went from that to this. This is amazing.
Yeah, it's really heartwarming, if I can use that term, to know
Yeah.
that sometimes I get lost because I'm so busy. I get lost, and this is kind of what I do. And people come to me and say, "Oh, you've changed my life." And I kind of look like, who are they talking to?
Like,
You know,
what?
they're like, you know what? What did I do? And they're like, no, I feel so much better about myself and I'm able to do X, Y, and Z because I feel better. And so that's kind of where I am in my business. Of course, I do these procedures, which I mentioned, but what I really try to provide people with is confidence and better self image. And there are many ways to do that. And my part is through, surgery and plastic surgery specifically. So we're really trying to improve people's self image if they are the right fit and the right candidate for that.
Yeah. I think that the confidence piece is huge. I think sometimes with plastic surgery, I feel like there's people who are like, love plastic surgery.
Yes.
And then there's people who are like,
No way.
like,
No way.
no way,
Yes.
not
Yeah.
changing my body.
Right.
But it's like, if someone is so unhappy with themselves that they just like can't even look in the mirror, or they don't want to like wear a bathing suit, or whatever it might be, like, you cannot replace the feeling of that confidence. Like, that is the best feeling in the world, to just be confident in your own skin. And if it takes plastic surgery for somebody to feel that way, I'm like,
All
yes,
for it. Yeah.
go
Everybody's
for
on
it.
their own journey. You can ask a million people and you're going to get a million different answers. The answer lies within you. If this is something that you want to do and it's going to make you feel better and you've done all your research and you think it's going to be safe and so on and so forth, then go for it. Just, you will, of course, ask your loved ones and kind of get their opinion. But at the end of the day, it's for you and it's really about you. So if this is something that can help, then great. If you have other methods to help yourself, then use those as well. But plastic surgery is certainly shouldn't be demonized and it certainly shouldn't be abused either.
No. And I mean, I'm the first to tell you, like, I've had Botox before, I've had filler, haven't had it in a while, but
Okay.
it's like such a night and day difference. I mean, even little things like that, it is crazy how much better you feel after you
Absolutely.
get it done. So I'm a huge advocate
You're
of
your
it. I
fan.
love it.
Great. I'm
Yeah,
glad you're a fan.
I'm a fan. I love it.
Perfect.
But yeah, just why don't you tell us, if you could go back, let's say 10 years, and give yourself some advice. Maybe we'll just say like 3 things that you would tell yourself 10 years ago that maybe you didn't know that you know now. What would that be?
Okay. First thing, it's a great question. I would say try to have balance. And I say that with a little bit of an asterisk because as a entrepreneur, it begins and ends with you.
Yeah.
Doesn't mean that having balance means that you will come in at 9:30 and leave at 4:30 and have all the vacations and, make a ton of money. That's not quite the balance I mean. But take time out to not lean all into your operation or your business 24/7. Take time to spend with loved ones on their special occasions. It's okay. You can pull away from the spreadsheet or the phone call, or they don't need to have the meeting tomorrow, and spend some time with your loved ones. So that's the first thing, because that you don't get that time back.
I
The
love that.
second thing I would say is for physicians, we are not business savvy. I ended up going to business school in the midst of all this too. I got an MBA in finance. And
Add
so
that to the list.
add that to the list. I just thought it was helpful. I mean, I was operating my first business kind of on a wing and a prayer and gut. And I'm not saying that business owners that are really successful don't do the same thing, but I just need to know the business tenets and principles for which to operate. So if I could go back, I would probably do that sooner rather than later. I know a lot of medical schools offer MBAs now, and a lot of training programs will allow you to do that. So if you're in that funnel or part of the funnel, if that's accessible to you, please, by all means, do it. It's not only for you running your own business, but if you're an employee of a big corporation, you can ask some real hard questions and they will understand that you understand. And that's
Yeah.
powerful. And
Knowledge
then
is power, no
knowledge is
matter
power
what.
for sure. For sure. So I would definitely do that. And then the third thing is just this is not a job. This is a career. Have fun with it. This is if you're in your practice and it's your own practice, it's a great practice. Don't make it a job. Don't make it daunting. Make the environment healthy and good. Treat your employees well, treat your clients well. They'll treat you well. You're in a very fortunate position. Not many people in this world have your position. Don't take that for granted and be nice to everyone and enjoy your position in life and treat people well. So that's what I would say.
I like that. Kindness goes a long way.
Kindness
It
goes a
really
long
does.
way. It
And
really
that's
does.
that's something in healthcare that I feel like transcends, because it's like having a positive relationship, like you said, with not only your clients or your employees, but bedside manner.
Yes.
I think that is something that has really kind of taken a back seat
No
in
question about
healthcare. And a lot of times in healthcare, especially, people are seeing the doctor in a really scary, like vulnerable time
Right.
for them.
Exactly.
And it makes the world of difference if a physician, surgeon, PA, NP, whatever, MA, whatever you are,
Whatever.
in whatever
Yeah.
capacity, has warmth and kindness about them and shares empathy and is willing to just have that understanding that I know you're afraid, I know you're uncomfortable, whatever it might be, but I'm not here, like, I'm not the boogeyman, I'm not here to
No.
scare you.
No, not at
I'm
all.
here to make your life better, whatever that looks like in whatever capacity.
Absolutely. Make yourself human, you know?
Yeah.
It doesn't require a great amount of effort. It may be as simple as putting your hand on your shoulders, like, we got you. We're here. I understand. Validate their feelings. And it doesn't really take more than that. And people will take a deep breath and realize that, yeah, you care, because a lot of clients think you don't care. And we get rushed. And I've never been in a corporate environment, but I think the corporate environment has different metrics and different ways to approach things. And you've got to meet certain numbers, and you don't really get that time to do that. But really, you still can. It only takes a few seconds for you to put your hand on their shoulder and say, this is going to get better. I'm going to work with you. We're going to get through this. And you keep going.
Yeah. I'm sure you get that a lot too, because people are going to sleep. And when people go to sleep, that's
Yes.
like, people get really nervy when they're being put under general anesthesia. So I know I do. I'm like,
Yeah. So what I do on
Panic.
that is I go hold their hand and I rub
That's
their
awesome.
shoulder and I just say, so they can see me. The last person they see is me, because they are here because of me. And say,
Like, you might feel out of control, but I've got you.
I got
I'm in
this.
control.
Yeah, I'm here. We got you, and that's it. And so I try to do that. And that's just something no one taught me. I just felt that, you kind of have to read the room sometimes as a young practitioner. You don't know this, but as you kind of read everybody and read the room and read the patients, you go, I've seen a lot of my patients go to sleep and they look scared. What can I do about that? Let me just go stand by them. I think that's probably a reasonable thing to do. And I found that that's been helpful. So again, read the room.
Yep. I think that's awesome. Humanizing it, so important. We're all humans and we all feel afraid at some point or another. So
Indeed.
I think that's great.
Indeed.
Well,
Thanks.
Dr. Stephenson, thank you so much for your time today. I really do
I
appreciate
appreciate
it.
I appreciate you. It's been great.
And thank everybody that's listening on Spotify and all of our channels. We greatly appreciate it. And we will look forward to hearing more from you maybe soon here in the future, Dr. Stephenson. Thank you.
Absolutely. I would love to have you on my podcast. So we'll maybe make that happen. That'll be fantastic.
I'd love that. That'd be so
That'd be great.
fun.
Perfect.
Awesome.
Perfect. Let's do it. Let's do it. Well, thanks
Let's make
again.
it
I really
happen.
appreciate it. We're going to do that for sure.
Awesome. Thank you.
Thank you. Take care.
Bye.
Bye-bye.
Thanks for listening to the Healthy Careers Podcast, where we provide a platform for you to ask hard questions and get real answers. If you enjoyed this episode, don't forget to subscribe and share it with your friends. Stay tuned for more episodes every other Friday at 7 a.m. Eastern.
Well, I hope you enjoyed today's episode. We'll be back to our regular format next week with a very special guest, Nurse Tay, who does a lot of post-operative care here in Atlanta for plastic surgery patients. So just put that on your calendar. Remind yourself next Saturday to tune in right here to Plastic Surgery TNA. That's Plastic Surgery Talk and Advice, hosted by myself, Dr. Earl Stephenson, Jr., board certified plastic surgeon. Again, I really appreciate you guys. If you would like and subscribe to our channel, it really would help me grow the channel and do bigger and better things. Until next Saturday, please have a peaceful holiday weekend and fill your cup with gratitude. See you next time.